Thank you for joining this month's webinar. Our topic is Influenza, Don't Become a Statistic. And our presenter this month is Terry Somerville. She's an RN and a health coach with Strategic Health Services. Terry?
Thank you, Dawn. As Dawn said, I am a registered nurse. I have almost 30 years of experience, and most of my background came in working in critical care. And this topic is something close to me. As a critical care nurse, I did see the serious side effects of the influenza virus, and that makes it a good topic for me to discuss. So influenza, don't become a statistic. We're going to talk about what is the flu, what kind of viruses create the flu, what are the signs and symptoms of the flu, and how is it diagnosed? Who is at risk for having serious complications from the flu, and how is the flu spread? Vaccinations. There are multiple vaccinations available for us, and there are multiple routes that we can talk about that are also available. And then common misconceptions. I think we all have misconceptions about different health topics, the flu being one of the big ones. So what is the flu? The flu is many different viruses, and each year the United States and other countries suffer from flu epidemics. Typically put, that means we have a flu season. And the flu versus the common cold is difficult to determine because the signs and symptoms are so close together. The biggest difference is that the flu typically is worse and lasts longer. How to have it diagnosed? See your doctor. How it's spread? I'm sorry, let me back up. How to have it diagnosed? Of course, you're going to see your doctor, and he is going to go on your symptoms and then ultimately do what is called a culture, or take a long Q-tip and place it in your nares or your nose, and that culture will be run to see if the presence of the flu virus is there. Now, signs and symptoms of the flu. You have fever, you have congestion and cough, runny nose, chills, aches and pains, fatigue, sore throat, and body aches. And often, not often I should say, but there are some people that do experience vomiting and diarrhea. But people have these symptoms can also be infected with other respiratory illnesses. So that's why seeing your physician is an important thing. And as I said, to diagnose the flu, you need to see your doctor. Your doctor is going to listen to your symptoms. He's going to do the nasal swab for the influenza, the presence of influenza, and how to treat it. Okay, we'll talk about home treatments and medications. Home treatments, you're typically going to treat the virus, the symptoms of the virus. If you have a fever, you're going to take Tylenol, Advil, any of those medications that help break fevers. If you have aches and pains, again, the Tylenol, the Motrin will help with that. If you have a cough or congestion, a decongestant. If your symptoms are more severe, then you need to see your doctor and let him make that determination by doing the culture, because there are treatments available for people with the flu that are called antiviral drugs. Now, typically the antiviral drugs are a prescription medication. They're given to people at high risk for complications. Children under 2 years of age, and adults 65 years of age and older. Pregnant women, people with chronic medical conditions, or people with serious illness that is possibly going to lead to hospitalization. Those are the ones that the doctors will typically give an antiviral treatment to. Other people that come in that don't fall into those risk categories, it will be up to the doctor's discretion whether you needed to have an antiviral treatment or not. And it's good to know that treatment works best when it's started within 48 hours of getting sick. It is still beneficial if given later, but the studies have shown that when given later, but studies have shown that antivirals are often underprescribed. So just remember, if you're sick, you feel lousy, go see your doctor. There is something that can happen that can be given to you that will help you. So who is at risk with the flu? For developing flu-related complications, I should say. Children under 5, but especially children under 2 years of age. Adults 65 years of age and older. Pregnant women and women that have delivered within 2 weeks. Residents of nursing home and other long-term care facilities. Also, interestingly enough, American Indians and Alaska Natives seem to be at a higher risk for developing complications. People with asthma, people with chronic lung disease or COPD, which is COPD is chronic obstructive pulmonary disease, emphysema, chronic bronchitis, and even cystic fibrosis. Heart disease, people that have congestive heart failure, congenital heart problems, or coronary artery disease. People with kidney disorders, liver disorders, and people with the weakened immune systems are also at risk for developing high-risk complications. And these are people that normally we think of people with HIV or AIDS, or cancer patients that are being treated with long-term steroids or with chemotherapy. But also there are now medications that are being used to treat not a severe chronic illness, things like psoriasis, that if you've ever watched a television commercial and seen these, they tell you you are at risk for developing illness from this and that you shouldn't receive these medications if you're sick. So these people are also at risk. And how is the flu spread? Well, the flu is typically spread 2 ways, person to person and also by contact. Now, person to person, it's interesting to say that when we talk, sneeze, cough, we have droplets that come out, as you can see in the picture on the screen. It's a fine mist that you usually cannot see with the naked eye, but it's there. And that can spread for up to 6 feet away from you. So when you stop to think of how close you are talking to someone in a normal conversation, it's usually not 6 feet away from them. So those droplets can actually spread when you're talking, if you cough or sneeze, and they can land in the mouth or nose of a person that you're talking to, and then possibly be inhaled into their lungs. Less often we see people getting the flu by touching a surface or object that has a flu virus on it. And that's because of the length of the time that the flu virus will stay active when it's not in a person. To prevent the spread of the flu and to protect our loved ones, use good habits. Stay away from sick people. Stay home if you're sick. It's so important to wash our hands often with soap and water. And if soap and water is not available, then carry out one of those alcohol-based hand rubs and use that instead. Now, that is only good for so many times. You still need to wash your hands. The hand sanitizers are good for not emergency, but for those situations where you can't get to a sink. Linens and utensils belonging to a sick person should not be shared and without washing it thoroughly first. Eating utensils can be done by a dishwasher by washing with soap and water. They don't need to be sterilized and they don't need to be cleaned separately. Frequently touched surfaces should be cleaned with a disinfectant at home, work, or at school, especially if you know someone around you is sick. A good one of those is Lysol has a disinfectant. Clorox has the wipes that you can sanitize surfaces with. And this because the flu is very contagious. Most healthy people can infect another person beginning the day before their symptoms develop and up to 5 to 7 days after becoming sick. Now, children can pass the virus on for longer than 7 days, and their symptoms don't start for 1 to 4 days after the virus enters their body. So that means you can pass the flu on to someone before you even know you're sick. So it's just important to realize this and to try and protect yourself by always using the good hand washing techniques, by keeping surfaces clean, and for the flu by getting a flu shot. Now, vaccinations. There are different types of vaccinations. Um, the most common are it's a trivalent and a quadrivalent vaccine. And what that means is that the trivalent has 3 components to it. The quadrivalent has 4 components of the influenza vaccine. There are different routes of administration that are available. The 3 are intramuscular, which is the shot we're most familiar with, the one that goes into the muscle, typically in your arm. Intradermal, jet injector, which is the virus, or the vaccine, I should say, is injected into under the top layer of your skin with a jet injector. There is not a needle involved in that. And the nasal spray vaccine. And if you think about nasal sprays, that's how they do it. They just spray the vaccine up into your nose. And that one is available this year with the quadrivalent, for the quadrivalent vaccines. People that are 18 through 64 can get a jet injector with the trivalent, and the IM, you can get both forms of vaccination. Intradermal, as I said, will be quadrivalent this year. It changes year to year, so the best thing to do is ask your doctor or the person that's giving you the vaccination what type of vaccine you're getting. And the reason I bring that up is some of the vaccines are grown in egg. The virus is developed in egg. So if you have an allergy to eggs, you might not want to take that kind, because then you're not having a reaction to the flu, you're having a reaction to the medium that it's grown in. So I think it's always a good idea. There are options for people that have those allergies or who have had problems in the past, not to have to take that kind of vaccine and still be protected. Now, where can I get vaccinated, and what are the side effects of the vaccinations? Side effects are typically the same as what your children went through when they were receiving their vaccinations. You have the redness, soreness, warmth at the injection site. You can have body aches and pains and a low-grade fever. So I always tell people when I'm talking to them to treat yourself before you go get your vaccine to lessen the side effects of it. Take some Motrin, take some Tylenol, so that kind of kicks out that temperature and the soreness that you experience. Now, you can have these side effects for up to 2 days, so you need to treat accordingly. If you take something beforehand and in 4 to 6 hours you're starting to ache, have some redness and warmth at the site, feel kind of lousy, take some more Tylenol. It's just a normal reaction to the vaccination. It's not something bad. Where can you get vaccinated? Well, you can always get vaccinated at your doctor's office. You can get the flu vaccine at a health department. Pharmacies give them, urgent care clinics, a lot of schools and college health centers give them, and some work facilities, some places where you're employed, will give the flu vaccine. Now, there is a site that you can go to. It's called Health Map Vaccine Finder, and that can help you locate where you can get the flu vaccine. And who can get vaccinated? Anyone can get vaccinated from 6 months of age to older. Now, if you're 6 months to 8 years of age, you require 2 shots, and that's because it takes that much to get the immunity started in your body. Those injections or those vaccines need to be given no sooner than 4 weeks apart. So if you have small ones, remember that they really need to get the second vaccine to be protected. Now, common misconceptions. Do vaccines cause the flu? Do I really need the vaccine? Can I get the flu if I've had the vaccine? I have the stomach flu, and vaccinations can cause. Now, to start with, The flu vaccines do not cause the flu. They are either given, that what makes a vaccine is either a virus that is dead or has such a low activity level that it's just not possible to develop the flu from the vaccine. However, you can become ill even if you have had the flu. Sometimes the vaccines that we're vaccinated against just aren't a match against what's out there that year. The CDC tries to typically protect and predict what we're going to need for the year, but sometimes it's just not a good match. But even if you do get sick, your sickness is usually not as bad as it would have been had you not received the vaccine. And do you really need to get the vaccine? Yes, you do. The reason for this is the vaccine it protects you, it builds up antibodies in your body that will last in a healthy person with a healthy immune system for pretty much the entirety of the flu season. And even those that have a compromised immune system, people that have chronic illnesses, kids that are younger, pregnant women, it still usually will protect you for the entire time of the flu season, although towards the end, the immunity starts to wear off. Now, can you get the flu if you've had a vaccine? As I said, sometimes we're treated and it's just not the right fit. Sometimes you've already been exposed and have the flu vaccine, exposed when you get the flu vaccine, I should say. It can take up to 2 weeks, and typically takes up to 2 weeks after you get the vaccine for your body to build up those antibodies to protect you. So if you happen to get exposed and get the flu, you're not showing symptoms yet, and you get the vaccine, or you've gotten the shot, you've gotten your vaccination, and you're exposed to the flu virus, you still can develop the flu. It usually, I should say, doesn't, it again doesn't cause you to have as severe of an illness as if you've not had one. Okay. Now, vaccinations can cause. I know a lot of people with their children have decided against getting vaccinations because they've heard about the vaccine causing mental retardation, epilepsy, cerebral palsy. There isn't a study out there that shows that any of these things have happened because of the flu virus or the side effects of the flu vaccine. So it's most important to go ahead and vaccinate your kids and protect them. If they get a complication from the flu vaccine, which is pneumonia, ear infection, sinus infection, that can cause a lot more problems than the reaction that they have or the side effect that they have from receiving the vaccine. So I have to say the good outweighs the bad. And I would certainly think long and hard before deciding not to vaccinate my kids or myself. Every year people do die from complications of the flu. And this is hard for them to track because most often the people that die came into the hospital, say, with flu-like symptoms, and then developed a secondary complication such as pneumonia. And they consider that to be the cause of death, not the flu itself. So when you're looking at statistics, it's not really a good picture of what the complications can do to you. So now, I hope that some people, myself was included in this, have changed your mindset on some of the things about the vaccine. I hope to see this year be a better year for the flu season with less people being hospitalized and more of us staying healthy and stopping the spread so badly. But remember, you can always contact your health coach if you have a question. We're here to help you, to answer your questions and help direct you in any way we can. There is also a lot of educational material in our health library on the flu, as well as many other topics. on the My Pathway to Health website. So if you just want to look through there and read up on your own, that's a great place to go. If you prefer to talk to someone, give your health coach a call. I hope you had a great day. I hope we all learned something, and thank you for your time.